everyone, welcome back to my channel. It has been such a long time since I've done a video. This particular topic has weighed heavy on my heart, on my mind, and I felt like the best way to sort of kind of get through it is to just share it with someone, and I decided to share it with the world in hopes of possibly helping someone who is in the same situation, may eventually go through the same situation, or has gone through the situation. I would label this as my near-death experience. Now, I would like to throw in 3 disclaimers. One, this video will be quite lengthy. Either that or I'm going to have to do a 2-parter, because this is going to elaborate on my pregnancy, my delivery, and then the NICU experience. Number 2, please don't judge me if I'm sharing this story in a jokingly manner or fashion, because I know firsthand that nothing about this situation is funny. My 3rd disclaimer is this video will be simply TMI, too much information. So if you're one of those ones who gag and quease on the thought of blood, childbirth, or what have you, then I advise already that you should not continue to watch this video. In August of 2016, I found out that I was pregnant. Normally, your doctor don't see you until about 8 weeks out. They want to confirm pregnancy and to be sure that everything is growing and a heartbeat is there and so forth. I went at 8 weeks. Everything looked well. Pregnancy was confirmed. Went again around 10-ish weeks. The sonographer pretty much said that everything looked well. She did see a few fibroids, but it was nothing too alarming. I'm going to fast forward straight to the beginning of my situation. That was about, I believe it's about week 16. And if you guys see me looking down, it's because I'm looking at my phone for reference. I remember going to the bathroom. I wiped. And I looked at the toilet paper, because when I wiped, it felt very like slimy, like, you know, like when you are ovulating, ladies, your discharge is a little bit more slimier. It's like, I don't know, you know what I'm talking about. And that's what it felt like. So I looked at the toilet paper, and when I looked, it had like a reddish, brownish tint to it. It kind of put me in the mind of when you lose your mucus plug. Ladies who've been pregnant before, not everyone has experienced it, of course. But if you have, you know exactly what I'm speaking of with. So I'm thinking like, whoa, what is this? What in the world is this? So now I'm going to the bathroom like every minute, literally, just so I could be able to wipe and check the toilet paper. Now, moving forward, I did not see anything, but what I decided to do was just lay around. I had a doctor appointment scheduled that Monday, and that day was Friday. And you guys, you're going to clearly identify that the weekend was not my friend. I went to sleep. Early in the morning, it had to be around 2 a.m., 3 a.m. I just recall turning over and feeling something very wet in the bed, as if I had peed on myself. So I looked back in the covers, and I woke up to a crime scene. There was blood all over the bed. And then I stood up, and when I stood up, there was blood running down my leg. I immediately ran to the bathroom, sat on the toilet. That was my first instinct. I don't feel any cramps. I have not felt any cramps. There was no blood clots or anything. It was just running loose blood, pure red blood. I took a bath. I didn't know what was going on. Before anyone judged me, this is what I'm going to say. In my mind, I immediately thought miscarriage. Whenever bleeding is associated with a pregnancy, you automatically conclude that you are miscarrying your child. And that is not something easy to swallow. I've been pregnant 3 times prior, and I've never seen blood during my pregnancies. That was actually the best part of being pregnant and not seeing any blood. Hello. I just was trying to come to terms with the fact that I was losing, because in my mind, losing my baby. So after I took a shower, I put on some clothes. I put on a maxi pad. The hospital where I was supposedly be delivering at was about 5 minutes away from my house. I put on the pads. When we drove in the car and went to the hospital, I had already completely saturated that pad with blood like that. And of course, when you go to the emergency room, because mind you now, I'm waiting in the emergency room at 16 weeks, and you're not enough weeks to be allowed to go to the labor and delivery floor. Actually, you're not even enough weeks to even consider your baby vital. Which, when I'm saying vital, I mean that they can save it, basically. So now here's my emergency, but it's not their emergency. I went in the back. I asked them for a different pad because, of course, mine was completely soaked. I remember changing into the gown. I remember the doctor performing a exam down in the kitty cat area. And I just remember him saying that my service was still closed, which was good news. I remember him ordering a sonograph, and the sonographer came. She did her thing. I had to wait on the doctor to come in for him to let me know that baby is fine and that they had no idea where the bleeding was coming from. The doctor had actually ordered me to rest and more rest, and to come in on Monday morning to see him. I remember turning to Dr. Google, y'all. I was trying to self-diagnose me. I was victim of that. I did my self-diagnosis because at that time I was the doctor and Google was my assistant, or vice versa. And so we was going to determine what was going on before I went to that doctor, y'all. So I had determined that I was having a subchorionic hemorrhage, when blood gathers in the space between the placenta and the uterus. Y'all, I know, don't judge me. You will do it too. I just was looking for confirmation, I guess, from somebody that everything was going to be okay, because I was literally freaking out. I remember going to the doctor on Monday, and the doctor, he looked at all of the different things that the emergency room did, and I remember him saying, like, everything looks great. And he was asking me, was I still seeing blood? And I told him that it was like a brown, like, discharge, kind of like, you know, but it was nothing close to what I was experiencing. And so, you know, he just told me that I should take it easy. He couldn't give me an explanation because all the test results came back normal, which was good news. You know, it was not that I was looking for something. I just felt like if this is happening, then it got to be a reason that it's happening. And you just know that this is not normal because you know your body. Fast forward to week 17, everything was smooth. Week 18 or 19, somewhere up in there, crime scene number 2. I remember having a big bleed all over again. And at that point in time, I went to the doctor, the emergency room, because once again, it was a weekend. And the baby still looked healthy. Everything still looked fine. And the doctor still didn't understand why. And I just pretty much ordered him to please move up, because at the time I had a specialist appointment approaching. Simply because my prior pregnancy, I had a abnormal result with the spinal bifida. It came back elevated, one of the tests. And so because my doctor realized that happened, he had wanted me to be seen again with taking those tests. I just pretty much called his assistant and say, look, can you please have doctor to move up that appointment, because something is not right. I'm bleeding. No one's giving me any explanation, and I just need to find out why. I'll feel so much better if I find out why. And he agreed. And just like that, I was on my appointment seeing the specialist. Now, when I went to the specialist, I remember her performing a exam also in the kitty cat area, the vaginal area. She was just like, oh my gosh, your placenta is sitting literally right here above your cervix. Your placenta is not supposed to be under your baby, because when you deliver a baby, you're supposed to deliver your baby first, then the placenta delivers. Your placenta is supposed to be on top of the baby, and your baby is supposed to be in this area, whereas mine was the opposite. So baby was up high, placenta was down low. That explains the bleeding. All of the friction, movements, lifting, anything doing more associated with that was causing the bleeding. At that time, it was only a partial. I am going to insert a picture somewhere up in here, and it's going to show you a partial, a marginal, and a complete previa. From that point on, the doctor had instructed me to no longer continue to have sex. No lifting, no exercise, pretty much no being normal. He did not necessarily put me on bed rest yet, but he said that if it had not subsided or moved, that would come later on. Now, I know the next thing is people probably wondering, well, where did the placenta previa come from? Well, I had just had a baby in July of 2015. I found out I was pregnant in August 2016. This would be C-section number 4. So when I'm saying that I was not completely healed, my uterus, my womb, where they cut me open and so forth, was just not all the way healed properly. And then the fact that I had numerous of C-sections just said that most likely is the cause of my placenta growing and attaching itself down low instead of moving up where it should have been. Now, that's just partial of the experience that I endured. I'm going to fast forward to about week 20, 21. I know it was before week 24. I was working from home. I remember being on a call, and then all of a sudden I just felt faint. I felt crampy. I felt just something was not normal, and I put my collar on hold, and I just remember running to the bathroom, and I was in so much pain, and I was so hot, and I was sweating, and I didn't know what was going on, y'all. I remember just rocking and just saying, something's not right. I don't feel good. I don't feel well. And so it just was like, you should go to the emergency room. Let's go to the emergency room. So we ended up in the emergency room all over again. The nurses at the time said that I was dehydrated. So they gave me fluids in my IV, and then I remember them coming back saying, oh, you have a urinary tract infection, which surprised me because I drink so much of water, and I'm not even over exaggerating. Like, my household drinks a lot of water. I do. And it was just amazing. But I do remember reading that UTIs is quite common for pregnant women. So maybe, but it just wasn't really sitting too well with me because I couldn't understand how, when you know what you do or whatever. Cranberry juice and water was my best friend, so that was kind of odd. But they did put me on a medication to treat the UTI. They discharged me. I went home. That was Friday, y'all. That was Friday. And I started my medication, rest. The doctor told me he wanted to see me again on Monday. I remember feeling a sharp pain on my, right side, but at the bottom here. The pain actually was getting worse. It was to the point where I couldn't even sleep. Like, I didn't get no sleep that weekend. I went to Dr. Google again. Listen, y'all, don't judge me. Dr. Google told me that my appendix had burst and that I was going to end up having to have an emergency surgery. I was a complete mess. You already know all the emotions and all type of hormone stuff going through you. Oh, Lord. And then on top of that, I'm going through, it was just too much, y'all. I called my doctor on the weekend. I paged him. He called me back. He didn't took that long. I remember like it was yesterday. That was Sunday now, because this has all started from Friday. He told me that,
well, you need to give the medication some time for it to work. You just went into the emergency room on Friday, and you only had, about 3 dosages of the medicine, and that's just coming from the UTI.
I had already concluded that on Monday morning, if this pain had not subsided, that I was going to get a second opinion. And I know everybody was probably tired of me being in and out of the hospital, but I didn't care how nobody felt, because at the end of the day, I know my body. And I understood that something was not going well. And I felt like because I had as many dosages as I had, about 6 or 7 dosages, you mean to tell me that's not going to improve my condition? No. I want to share with you that if you're going through anything in a pregnancy or any situation and you know your body and something doesn't feel right, get that second opinion, y'all. This second opinion saved my life. Literally. I went to the emergency room Monday morning. I explained to the ER doctor what was happening. So the doctor ordered some tests. I remember him coming back and was saying, you know, we did the ultrasound, and on the ultrasound, there's something back there, but I can't really make out of it. So what I want to request is for you to get an MRI. And I was freaking out because I'm like, an MRI? Can you even get that while you're pregnant? You know, I was just asking him all these questions, and he was just like, you know what? Well, as there's always a risk in pregnancy, but this is serious, and that he felt like I should get it for the sake of my life, for the sake of my baby's life. And I'm so glad that I went ahead and decided to get the MRI. As I was laying there, because you're in this like tight space machine, I just was thinking, I just was like, oh my gosh, Lord, what is this? What is this? What is now? What is this happening now? Like, something else? I'm already got placenta previa, like something else. And you know, I was just praying and praying and praying and praying, waiting and doing a lot of waiting. And then I remember the doctor coming back in, and he was just like, well, we found what it was. Deep vein thrombosis on the right side, where you're feeling all of that sharp pain and so forth. And basically, y'all, that's just another word for a blood clot. At this point, I have a blood clot in my ovary. I pretty much blanked out of everything else that he was saying, but I do remember coming back and remember him saying that this is something that could possibly break off and spread. And so we want to immediately begin treatment. So I remember a nurse coming in and giving me a shot of Lovenox. So here I am on Lovenox, 100 milligrams. I remember her giving me the shot, and I remember him making a phone call to my doctor, which I wish I could have been on the phone when the phone call was made, because according to him, it was nothing, and that I was not giving the medicine the time to work. And I remember the ER doctor saying that you're blessed to still be here, and if you had not came, there's no telling what could have happened. I just was freaking out because I kept elaborating on the what ifs. What if I would have waited and listened to that doctor? And not saying that he didn't know, but I just feel like if maybe he should have been a little bit more, I don't know. I don't know. I just know that even the emergency room doctor was just saying that a lot of wrong could have went in this situation, and it was a blessing that I went ahead and came in. And I just remember him saying, I know, I didn't expect to find that either. So I'm guessing that's what the doctor said to him. And then I remember that I had to be transferred from the emergency room where I was at to the emergency room that the doctor was working out of. I was transferred over to the hospital, and I just remember the doctor coming in and seeing me the next day, and he was just looking like he saw a ghost, because he was like, I can't believe it, like I honestly didn't expect this. And I just remember him saying that, you know, when you first came to me and I asked you, have you had any issues with pregnancies, which I have never had in the past, y'all. And he was just saying that because that I'm having so many issues this particular pregnancy, he really wants me to be under the care of a high-risk doctor. I already know a blood clot is serious, but I felt like he felt that it was more deeper than that. Deeper than rap, basically. He just pretty much just broke down everything. What doctors I was going to be seeing, that I was going to also see another specialist, and that the specialist that I did go see that diagnosed me with the Placenta Previa works alongside him. And since that he was letting me go, both of them was going to be letting me go. It was just a lot to swallow at one point. And then he was just letting me know that, hey, because you have a blood clot in that particular area in your ovary, it can potentially break off. If you feel any type of way with breathing, having breathing complications, or if you feel something just is not right, do what you did this time and go to the doctor now, the hospital where that was going to be seeing me moving forward. I remember going home and being home for maybe a week. If even I made it a week. I don't even think I made it to a week. I just remember I had stairs in my home. So going up and down the stairs was very hard for me. I had chest pain out of this world. I remember going to the hospital, to the emergency room. I was letting them know exactly how I feel currently. I can't even elaborate enough on the type of pain that I was feeling. It was like, if you ever had pneumonia, and I had pneumonia before, I remember being hospitalized before with this same exact chest pain. So I figured that if it was not something to do with a blood clot, maybe I was developing pneumonia. I don't know. But I went to the emergency room. They ran their tests. And of course, I was freaking out all over again because I'm like, I cannot get a chest x-ray and I'm pregnant. The doctor was just like, you know what, we just really suggest this. It's up to you, but we really, really recommend you doing something like this because of your history with this pregnancy. We just want better. We want to be safe than sorry. And so, you know what, when I heard that, I was just like, you know what, I got to do what I got to do. I sucked it up, did a chest x-ray, and guess what, guys? Not only did I have a DVT just that fast, partial of my DVT had broken off and traveled into my lungs, and now I developed a PE, pulmonary embolism, which is pretty much essentially a blood clot in the lungs. I went from having a DVT to now having a PE and having placenta partial previa, all in the same pregnancy. And this is coming from a person who had absolutely no issues in the prior pregnancies. Like, I'm not even gonna lie, y'all. I truly believed at a point in time when I first was admitted that I was probably not going to make it out of the hospital. I know that in these type of situations, you should always remain faithful and positive, but it was so hard to do so coming from how I felt like I was cornered and boxed into these situations so quickly. I was hospitalized for nearly 2 weeks. I was then put on heparin, y'all. Heparin is pretty much a blood thinner. I was hooked up to a machine 24/7. It was 24/7 monitoring. It was to the point that if I got up and went to the bathroom, I had a nurse coming in because my heart rate would increase like sky high. And she was running and she's like, they're calling me and they're saying that your heart rate is increasing and I just wanted to come and find out what you're doing. If I did any extensive moving, it would increase. And they just kept saying, you know, you have to lay around. I don't want to cry, y'all. I don't want to cry. But it was pretty intensive. I hated giving myself those shots. They burned, they stung. But the only thing that I kept focusing on was the fact that this is going to help save me and my baby. I bruised. I had a bruising, and I wish that I would have took pictures, y'all. But I had all kind of bruising all over my thighs, all on the side of my stomach, because those were the injection sites. And it was terrible. And I just remember every day someone from labor and delivery would come down and check baby every morning. I feel like that's the only thing that I look forward to. I remember finally being discharged. I want to say that when I went home, I was now under strict cares of the high-risk doctor. And I remember going to my first appointment and them laying down like, you look at this, what's going on with you? You have placenta previa, you have a DVT, you have a PE, and I mean, Lovenox or any type of blood clot medication already raises your chances of bleeding. When you're on blood thinner medication, you bleed more. You're prone to bleeding. Your blood is thinner. It runs more. I was in a situation where I'm having a bleeding issue, my placenta. And while this could be why my episodes was a little bit more frequent than others, maybe not. Joining Baby Bump. But all of you lovely ladies from Baby Bump, you guys meant the world to me. Like, you guys actually allowed me to make it through these tough situations. I met some ladies that was going through the exact same thing. I just want to thank all of the March mommies, April mommies also. there was a lot of people that was very supportive and praying for me, you know, and it meant a lot. It meant a lot. So hey y'all, and thank you.